Good afternoon. I'm Dr. Jas Atwal. I'm the Acting Deputy Chief Provincial Public Health Officer. I'm joined by Dr. Josh Reimer, Medical Officer Health and Medical Lead for Manitoba's COVID-19 Vaccine Implementation Task Force. Today, we are announcing 5 additional deaths due to COVID-19. 1 from Northern Health Region, 1 from Prairie Mountain Health Region, and 3 from the Winnipeg Health Region. I want to extend my condolences to the families, friends, and caregivers to these individuals announced today. The current 5-day COVID-19 test positivity rate is 9.6% provincially and 7.4% in Winnipeg. As of 9:30 a.m. today, 158 new cases of the virus have been identified. The total number of lab-confirmed cases in Manitoba is 26,695. Today's numbers continue to be encouraging. We are headed in a good direction. It's encouraging. The actions taken by Manitobans is making a difference. However, it is too early to start a victory lap. With positive cases identified on or around December 25th and the close contacts related, it is necessary for us to buckle down for a little bit longer. I know it has been hard, and we have been asking you to do this for weeks now. But we can do this. If we let up now, all the hard work for the past several weeks could be for nothing. We could be back to where we started in November. We need to do this in order to bring our numbers down further and reduce the strain on our healthcare system. Despite lower case numbers, we're not back to normal. We have to keep focusing on the fundamentals to protect ourselves, our loved ones, our neighbors, and coworkers. Stay home when you are sick. Stay home and self-isolate if you're waiting for test results. If one person in a household is waiting for test results, the entire household should self-isolate as well. Keep washing your hands, covering your cough, wearing a mask. We need to continue to make these sacrifices in the short term so that we can be safe in the long term. Thank you, and I'll turn it over to Dr. Reimer.
Thank you, Dr. Atwal. Good afternoon. I'm Dr. Josh Reimer. I'm the medical lead for Manitoba's COVID-19 Immunization Task Force. Today, I'd like to announce that the eligibility criteria for COVID-19 vaccination has been expanded and will now include staff who are employed in congregate group care settings who provide direct care to individuals in the community living disability services, child and family services, homeless shelters, and family violence shelters. Manitoba Families is working directly with the agencies involved to identify the eligible staff, and they will be contacting those staff directly to arrange for their appointments. Yesterday, we also expanded the eligibility criteria to include healthcare providers who work in hospital, emergency, and urgent care departments with no age restrictions. Regarding adverse events following immunization, we now have a total of 8 APHEs reported. 6 of those have fully recovered, and we are awaiting further information on the other 2. I don't have any information regarding the number of wasted doses today, but I can say that we remain well under the estimated 5% wastage expectation that was set out by the manufacturer. As of Tuesday, January the 12th, 12,409 doses of vaccine have been administered in Manitoba. This includes 10,749 first doses and 1,660 second doses. The regional percentage breakdowns of the vaccine that have been administered are as follows. 9% in the Interlake Eastern Health Region, 2% in the Northern Health Region, 4% in Prairie Mountain, 10% in Southern Health Santé Sud, and 75% in the Winnipeg Health Region. Vaccinations are now underway at personal care homes across the province. This is being done by our focused immunization teams. It is expected that all personal care home residents who are eligible for the vaccine will be offered a vaccine within the next 28 days. As of yesterday, we have confirmed that 120 residents have received the vaccine in a personal care home. At this time, our data does not include vaccinations that are provided in First Nations communities. The Manitoba government continues to have collaborative discussions with our First Nation leaders in respect to the publication of vaccination data for their communities. As of January 12th, 28,080 doses of Pfizer vaccine have been shipped to sites in Winnipeg and Brandon, as well as to personal care homes across the province. More than 5,300 doses of the Moderna vaccine are being shipped to First Nations communities, with 2,000 doses of Moderna being used in personal care homes in community across Manitoba. Manitoba's current vaccine inventory is 15,402 doses of the Pfizer vaccine, which will be used to administer both first and second doses in super sites in Winnipeg and Brandon, as well as 2,000 doses of Moderna, which are being used to immunize personal care home residents. In addition, we have the 5,300 doses of Moderna that are being allocated in First Nations communities. As of January 12th, 1,071 people have been hired to assist in Manitoba's vaccination efforts. This includes the Winnipeg and Brandon sites. These numbers include immunizers, clinic managers, clinical leads, system navigators, and observers. This is in addition to the 595 staff who have been assigned to COVID-19 immunization from other parts in our healthcare system. So this brings the total of both new hires and existing staff to 1,666 individuals. So at this time, we would like to open up to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions this afternoon. Up first from CBC Manitoba, Bart.
Hi, Dr. Reimer. We're interested from the technical briefing that the goal remains right now for 70% of the adult population to be immunized by the end of the year. It's basically worst case scenario. That's 18. If that's 18 and up, why not 16 and up? If the manufacturers of the vaccine say that their product is approved by Health Canada for 16 and up.
So we're using the adult population as our base estimate because some of the products are approved for 18 and over and some of the products are approved for 16 and over. Right now, in order to get us the most accurate ongoing data based on that variation in product approval, we've decided to use the adult population. However, we do recognize that as the science evolves and as the products become more available, we will continually be assessing whether or not to expand to other age groups.
Now, we heard earlier today that there's capacity exists to scale up a lot if more doses arrive. Where do you see doses going in the next 3 months, like basically by the end of March, with the announcement yesterday that the Moderna product is coming in a larger shipment?
So as was mentioned in the technical briefing today, we intend to use a large proportion of our immunizations still in the super centers that have been identified in Winnipeg and Brandon and Thompson. But in addition, we are using our focused immunization teams to reach out to personal care homes. And in the future, we're looking at using those same teams for other congregate settings and other settings where people may not be able to move to the vaccine super centers. Likewise, we are looking at the evolving science and the approvals for future vaccines, and we are having some planning conversations with our pharmacists and physicians around doing a more distributed model should any of those vaccines that have less stringent storage and transportation requirements become approved and available in Manitoba.
And my last question here is, we've seen 3 out of 4 of the priority groups that identified late last year getting some vaccines, but we haven't seen anything about that 4th group, everyone aged 80 and over. When do you expect that the vaccines of some form will begin to roll out to everyone aged 80 and over, regardless of where they live?
We are actively looking at the prioritization populations as outlined by the National Advisory Committee on Immunization, and our team is looking at the local epidemiology as well as the broader scientific data, and I expect that we'll have some information about the next priority groups available by next week.
From the Canadian Press, Steve.
Good afternoon, Dr. Atwal. Almost half the cases announced today are in the Northern Health Region. 70 cases on a per capita basis is quite large for such a small population region. Can you tell us a little bit what's going on up there?
Yeah, thanks for that question, and thanks for noticing that. We have a number of cases in a couple of communities. One is Lynn Lake, one is Thompson, where we've had a number of cases, so 37 in Lynn Lake today announced and 14 in Thompson, related to larger households and some spread amongst households as well. So there's work being done to contain and mitigate the spread of virus in those communities as well. And there's about 15 other cases that would be related to First Nations Inuit Health branch communities, and that information is available through the Manitoba First Nations Pandemic Response Coordination Team as well.
Thanks. And Dr. Reimer, I know these estimates on vaccine distribution have to be based on fairly conservative estimates based on what the distribution that the federal government can sort of guarantee at this point. But with more vaccine coming on, more potentially being approved, what is our capacity? What is Manitoba's capacity should more vaccines arrive?
So we have really been overwhelmed by applications from Manitobans who are eager to participate in this program. And so I first just want to say thank you so much to everyone who has applied for one of those positions. We really appreciate it, and we will be continually hiring more individuals. So we encourage people to continue to put forth applications as we go forward. That said, we already have a large enough number of people that have been hired that we could ramp up substantially with our vaccine rollout. And the numbers that were provided in the technical briefing earlier demonstrate that with substantial expansion and with the existing applications we've received, we could expand to the point of reaching all Manitobans by the end of April.
Thanks for that. And does that include the forward-looking expansion plans, such as using pharmacists and people off-site to deliver the vaccine?
So I would refer back to the technical briefing and get some of the details from them, but the expansion would include things like using broader portions of the convention center in Winnipeg. It would include opening up another super site, for example, as well as some of the mobile or pop-up sites that would be happening in some of the communities if we were able to get enough vaccine to provide that many doses.
From CTV Winnipeg, Michelle.
Hi, my first question is for Dr. Atwal. For the next round of public health orders, is the province looking at easing restrictions on a regional basis, depending on each area's COVID-19 situation?
Yeah, we're continuing to look at the epidemiology of COVID in Manitoba, where the risk is. At this point, we're still analyzing that information and determining what the next order should look like. Once we've come to some decisions or want to take that next step, then that information will be provided.
Thanks. A question about the potential for pharmacies and doctors and clinics to administer vaccines. Why isn't it feasible with the Moderna and Pfizer? Can you explain?
So the Moderna and Pfizer vaccines are very sensitive vaccines. The mRNA is held in a nanoparticle that can be damaged very easily with any changes to temperature when it's stored, for example. So we have to be extremely careful how we handle it, how we transport it. Even as much as shaking the vial can disrupt the particles and make the vaccine less useful. So rather than sending it out to multiple sites like we do with our flu campaign, for example, we've been required to ensure that we have the freezers in place, including the ultra freezers for the Pfizer product, and that we minimize as much as possible how much time those vaccines spend in transportation, as well as how much disruption there is during transportation. For example, not sending a thawed vaccine down a gravel road where it might be bumpy and cause some damage to the vaccine. So it would be wonderful if we could do a largely distributed model with those mRNA vaccines, because we would love to leverage the existing workforce and the existing procedures we have in place for our flu campaigns. But it just isn't feasible with these vaccines based on the information the manufacturer is sharing with us today. If that changes, we certainly would welcome expansion to more sites to make it as convenient as possible for Manitobans to get access to vaccine. And if other vaccines that have less stringent storage requirements become approved, we will ensure that we have a distribution available that is reflective of the needs of those vaccines in place.
Okay. And we also learned, if we had 1.8 million more doses available, we could get all Manitobans both doses by the end of April. So I just did a little math, and that's like 20 to 30,000 doses that would go out every day. Can you tell us where you got that number from, and kind of just explain where that came from?
So our logistics and planning team did a lot of analysis on spaces we have available, on the number of individuals who have applied for positions, on the number of people who can do deliveries of vaccine, and we have determined that if we were to expand the RBC Convention Centre to include all 3 floors, if we added a 4th supercenter to the rollout, if we expanded beyond the current plans for both Keystone and Thompson, as well as increase the number of FIT teams, the focused immunization teams, and finally also set up some smaller pop-up or mobile clinics in a variety of communities, that with all of those together, we would be able to provide the high numbers of daily doses that you're referring to.
From City News, Mike.
Hi there. My first question is something I asked in the technical briefing, just looking for the attributable version. So in the changeover in PPE during the FIT teams, I believe it was Dr. Reimer who spoke about this. Can you explain how often they need to change their PPE over the FIT team while they're giving vaccination?
Sure, that's a great question. Thank you for asking it again. The personal protective equipment, or PPE, differs from setting to setting. So our focused immunization teams need to look at the setting that they're going to determine exactly which infection prevention and control procedures they need to follow. So for example, there are differences if they go to a personal care home that is in an outbreak versus one that's not in an outbreak. Likewise, in a facility that does have an outbreak going on, there may be differences in what PPE is required from one resident to the other, depending on whether or not that individual has been infected, whether they're considered a close contact, or whether they're considered to be a low-risk individual. So for example, if they're in a personal care home that is not experiencing an outbreak, they can use the extended wear personal protective equipment, which is a mask and eye protection, and those they can wear throughout the entire clinic without changing them. However, if they are going from room to room where folks are either known or possibly infected with COVID, they need to change some elements of the PPE to ensure that they are not taking the virus from room to the next room. So that means that they would need to change, to wear and change a gown and gloves in between each resident.
Thank you. A follow-up question, I believe, is for Dr. Atwal. I asked this to Premier Pallister yesterday. Have you read any of the documents and requests from the Manitoba Body and Art Association that they've been sending in requesting that they be deemed essential? Is this a discussion you're having? And do they have any hopes of being talked about as being essential services?
Yeah, we have regulated health professionals that are able to open and provide those services right now. Tattoos and body piercing places aren't regulated health professionals. As on an ongoing basis, as we've talked about before, we are looking at the orders to see what would be available for Manitobans to get services. And again, those discussions are ongoing. And again, once something does become available, we'll make that public facing for sure.
And just my final question is a part two to that. In the first reopening, they lobbied to be part of the phase 1 reopen, and they were given phase 2. I believe they originally slated as phase 4. Do you know where tattoo and body modifications would land in this reopening, or are they set for any certain phase already?
Yeah, again, we have to look at the whole system. We have to look at all the sectors. We have to look at things within a sector as well. And we are going through that process right now. So there is no true designation as might have been before, so it might look different than before as well. Again, when those decisions are made, that would become public.
From CHVN, Taylor.
Hi, good afternoon. We know it's potentially not going to be months for the average Manitoban to get a vaccine. And, not knowing when you're going to be able to get that shot in your arm, how do we stay hopeful?
It could go to either Joss or I or Dr. Reimer and I. There's again, it comes down to the fundamentals. We're trying to limit risk to Manitobans. We want to ensure that Manitobans are under the least restrictive means. We need to continue to focus on those non-pharmaceutical interventions. We want to make sure that, if you are sick, you're staying at home. You get tested. You want to make sure that, if you're coughing, you want to cough in your sleeve. You want to look at that hygiene component. You want to look at that 6-foot distancing, only go out for those essential items. As time goes on, I obviously, the orders will change and things will loosen up. But even in those instances, it doesn't mean life goes back to normal. Like, we still have to consider those non-pharmaceutical interventions, and we're all responsible for that. Whether you're a person in Churchill who's a teacher, or the 12-year-old at a school in Winnipeg, or a farmer, everyone has to be responsible, take on that responsibility, not only for themselves, but for other Manitobans, and to look at these restrictions and doing their part to ensure that Manitobans are doing their best to have the least amount of restrictions placed on them.
And it's a lot of work for a long time. How do we combat this kind of COVID fatigue when we don't really know when it's going to end?
Yeah, we've gone through almost a year of this, in relation to a world living with COVID. We've had restrictions in to some degree, and those have ebbed and flowed, up and down in relation to what those restrictions are. Perseverance is required. You need to connect with individuals, make sure that, you're able to connect with your healthcare providers, use virtual connections, phone. I've gotten my kids to write letters to their grandparents. There's lots of different things that we can do to make those connections and social connections occur for our mental health, not only for ourselves, but our family and friends as well. So pursue all those things that one can, and there's plenty of tools out there, I think, for people to do that. This isn't a lifelong burden that we're going to have to face. I think, again, we're seeing a little bit of light at that end of that tunnel here, but it still is a bit of a ways away. And we still need to continue to do our duty to make sure that we're able to get to that point.
Thanks. And what are some signs that people could be experiencing when they do have COVID fatigue?
Well, there's impacts on people's mental health, emotions, anxiety, added stresses, perhaps temperament issues at home. There's a variety of things. Again, it's important to connect with people, connect with your healthcare provider, connect with friends and family, call them, virtual, letters. Do what you can to make sure that you're able to connect with individuals and speak and have conversations. Look at having some hobbies, puzzles, board games. There's lots of other things to do where it is a little bit more solitary, but you can connect with others as well virtually with those activities as well. By no means am I giving a list of everything that you can do, but those are some things that we've done in our household to work on connecting with people, keeping busy, and doing things that are different than what we used to do before.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Atwal, what are some of the priority areas for public health when it comes to potentially rolling back restrictions? And do you think reducing restrictions on household gatherings might be a part of that first rollback?
Yeah, again, this comes down to, we're going to look at the epidemiology of COVID. We're going to look at risk. We're going to look at our lessons learned as well as Manitobans, so we look at our local epidemiology in a region, let's say. We look at it provincially. We look at it in other provinces, nationally and internationally. And then from that, we look at where the risk is. Again, we want to have the least amount of restrictions placed on Manitobans, but we also want to make sure that we don't end up on a pendulum here where it swings the other way really fast, and when we're in a dire situation with number of cases developing in a short period of time and our hospitalizations going up. So everything's going to be taken into account. Obviously there's lower risk activities, and again, we're going to be looking at that. We have been looking at those restrictions on a day-to-day basis, and when we're ready and when decisions are made, we will provide that to the public.
Thank you. Dr. Reimer, I was hoping maybe you could explain why so few care home residents have been vaccinated since Monday, just nearing 20 according to the bulletin. So how are we going to get to those more than 1,000 residents that are still scheduled for this week?
Sorry, it was a bit hard to hear you. Could you ask the question one more time?
Oh, yeah. For sure. So on vaccinating care home residents, there's just 120 to date since Monday, so how are we going to get to the more than 1,000 who are scheduled for this week?
That's a great question. Thank you so much. So on Monday, we provided 120 immunizations to personal care home residents. The plan on Tuesday was to continue and provide further immunizations. I just don't have the numbers for Tuesday reported to me yet. And then today as well, I've heard that things went very well in Interlake Eastern and for their first personal care home site as well. Our intent really was to start in week one with some broader lessons learned type clinics to ensure that we were doing everything in both a safe and effective way. But our schedule is going to ramp up quite quickly starting next week, where we'll be doing multiple personal care homes each day. So right now our schedule is very much on track to reach all personal care home residents in 28 days.
Okay, thanks. And I guess, Dr. Atwal, I would like to follow up again just on the restrictions. So can you say with any certainty whether the restrictions on household gatherings will form part of our initial rollback? And you talked about risk. What sectors, I guess, are the least risky based on our epidemiology at this time?
Yeah, so we're looking at everything. So nothing's off the table. Obviously there are riskier activities and less risky activities as well. So I think we've talked about this before. Let's say being outdoors is less risky than being indoors, right? And there's a whole bunch of variables and other things that we could look at in relation to just those two areas, and even subdivided into that, there's a lot of different areas to look at as well. So I'm not here to speculate. I think we need to do some work on this, and we are doing that work. And again, once it's available for the public, we will provide that to the public.
From Global Television, Joe.
Hey there. First question, I'm wondering if someone can lay out where most of the current cases are coming from, whether it's close contacts, work, grocery stores, etc.
Yeah, thanks. Most of the cases are contacts of known cases. Household contacts would be the main culprit at this point in Manitoba.
Thank you. And regarding vaccines and the immunization clinics, and given the amount of staff needed, would it be even more important now to not overwhelm the healthcare system because we need that staff to be able to vaccinate so many people?
So we are actively hiring large numbers of people to staff our immunization clinics, and the numbers I shared earlier do include existing and new staff. And while we want very much to continue to add new hires that don't tax our healthcare system, it's also important that we have some of that clinical leadership available at each site to make sure that they're doing everything in a safe way that's consistent with the science. But our intent is certainly to continue to hire new folks from areas outside of acute care. So for example, we've been reaching out and hiring people like dentists, to participate in the immunization clinics. And we intend to continue to expand in that direction with some of our existing healthcare staff providing leadership, but increasingly depending more on the new staff so that our healthcare providers can go back to their other roles in the rest of the healthcare sector so that we can continue to provide that essential service to Manitobans.
Thank you. And last question. When can we expect the surveys to come out for Manitobans to fill out on easing restrictions?
I think there is going to be some engagement happening. I'm not too sure if it's a survey or whatnot. I think further information will be provided in the next few days.
From the Brandon Sun, Kyle.
Good afternoon. The Brennan Supersite is set to open on Monday. And so I was wondering, what are some of the rough edges that you guys experienced at the large Winnipeg immunization site that you are looking to smooth out as you set up similar sites in both Brandon and Thompson next week?
Overall, I've actually gotten really wonderful feedback on what's happened at the RBC Convention Center. So I really want to congratulate the team there, the managers, the immunizers, the clinical leads. For the most part, it's been extremely smooth, a very efficient process. I'm getting, texts and emails and phone calls from colleagues who have been through there and are expressing how convenient it was for them, which is, sometimes something unexpected when you're talking about a clinic setting. I think there's a lot of lessons learned about how things can go so well. For example, our navigators have been really important to help people move through the clinic in an efficient way, and so that people feel that they are knowledgeable about what is expected of them and how to move to each next step while they're in the clinic. I think it's also really essential that we have those clinical leads available. We're doing a lot of these new hires and providing a lot of training to them. But as they're new to the immunization world, it's wonderful that we have these clinical leads on site who can answer questions and provide guidance for some of the more complicated situations that we're faced with.
And is the current number for the amount of people who are staffing the Brandon site still 67?
I don't have those numbers in front of me, but I can speak with our workforce experts and we can get some numbers to you.
From CJOB, Will.
Good afternoon, everybody. Dr. Reimer, looking at your vaccination plans across the province, we have tons of remote, isolated areas. How many mobile or pop-up sites are you looking at? Or to put it another way, what is the farthest someone might have to travel to receive the vaccine?
So we have many different settings that will require a variety of different approaches in Manitoba. As we know, our geography and the way our population is distributed varies quite a bit across the province. So some of the remote and isolated communities, the services are being provided in collaboration with First Nations Inuit Health Branch, for example, or on Gomeson Health Services. Other communities might be reached by one of Manitoba's focused immunization teams. And as we move further in our rollout, particularly if we do get access to more stable vaccines, we'll be looking to have a variety of different mobile or pop-up sites in a larger number of communities so that Manitobans can get to those sites without having to travel long distances. At this point, because our supply is so limited, we are trying to focus on moving people to the vaccines wherever possible. But all options are still on the table as far as where we can reach all of Manitobans, and we will be working very hard to ensure that all Manitobans have access through one mechanism or another.
Okay, thank you for that. To Dr. Atwal now, remote learning for students coming to an end, kids going to be back in the classroom pretty soon. What is your message to parents, or even students for that matter, who are worried about returning to a congregate setting?
Yeah, a great question. So the plan is, school returning to where it was at prior on the 18th. Schools are safe. We've got schools, we've had school-age data on, data on school-age kids. We've had experience in that. Our epidemiology shows that young kids, their risk from a COVID infection at school is really low. It's much lower than the general population. That risk does go up as kids get a little bit older, but even in those situations, that's still much less than the general population. I think schools have done a tremendous job. Public health has been working with them, last summer and prior to last summer in relation to making sure schools have policies and procedures in place to ensure that students and teachers are protected. Again, our epidemiology has always shown that as well. So my kids go to school as well, and I feel very comfortable. They're safe at school. I have to say, this is a very different year in relation to viral infections in my household. I work in clinical practice as well. There's much less virus and infection going out there because everyone, is in some way taking responsibility for themselves. They are washing their hands regularly. They're staying at home when they're sick. They are distancing. They're wearing a mask. So all those things, add up to creating and mitigating, creating a low risk environment and mitigating risk. So again, schools are safe. I think parents and students should feel safe going to school, practice those non-pharmaceutical interventions, and they'll continue to be safe.
Okay, thank you for that. And pretty much weekly we're getting messages or emails from people asking about the drug ivermectin in treating COVID-19. Could you please address this and maybe just tell us, are there other therapeutic drugs out there right now that you are considering or would consider using?
For COVID-19, we have a group of specialists who look at all medications available. They look at international data. At the present time, I'm not aware of ivermectin being used in Manitoba or even in Canada in relation to treatment of COVID-19. So again, there is work being done on that. We look at local information, national, international information in relation to that. There really hasn't been any advances in relation to treatment of COVID-19 that is scientifically proven to be effective. There's some trials out there, obviously, but at this point, we're using the gold standard in Manitoba.
From the Winnipeg Sun, Scott.
Hi, good morning, I guess good afternoon to both of you. Scott Billick here from the Winnipeg Sun. There's a report today, so community transmission data, the sources of COVID-19 spread, that data had to be found through a Freedom of Information request. And I'm wondering, I guess, why doesn't the province release data on community transmission sources? And when will you start doing it? I guess my question is, why did we have to go through a Freedom of Information request to get, just some simple numbers of where exposures were?
Yeah, just to talk about those exposures as well. We have to understand what those numbers mean. Does it mean that, if 2.8% of all cases were exposed to retail, example, that means retail was a source of their acquisition or their source of acquisition. That's where they got the virus from. The data we collect is sort of retrospective, meaning we ask a case, what have you been doing for the previous 14 days prior to symptom development? From that, we gather information. And then from that information, we have a list of places that a person went to and then from that, we look at that information. These places aren't mutually exclusive, though. So we're not saying that acquisition occurred in a retail. We're saying that that person or those 2.4% of people went to a retail environment, but they could have gone to some other environment as well, like a outdoor hockey rink or someone's home as well. So you have to be careful when looking at data, and if we don't look at it properly, it can cause some confusion as well. So just want to make sure that people understand, numbers mean something, but there's a definition behind each number, so you do want to look at it in a careful manner as well.
Fair enough. So I guess, I'll ask another one on that. I know education institutions and daycares were, I believe, fifth on the list of number of exposures, yet you guys have said all along that schools are safe and that, it's expected they'll reopen next Monday. I guess, so given what I'm looking at in terms of these exposures, somebody would say, well, that's, the fifth leading cause of cases or at least exposures in the province. How is it safe when you guys say it's safe? So can you provide then the context of educational institutions like schools and why parents next week should be, confident they can send their kids back to school despite, 216 exposures between November 1st and December 15th?
Right, so I mean, so let's say a student tests positive as an example, right? They're at school, so that would come up in this number here. Maybe they were at a store, that would come up in this number. Maybe they were at someone's house, that would come up in this number as well. So again, it's just one identified place that student had been. It is not the only place, it's not the only risk associated with that. With school-aged cases, there's an extensive investigation that's done as well to look at risk of exposure within the school. So obviously we have a case investigation. From that we look at contacts, right? So we understand who the contacts are and we follow up with them on a public health side as well, if they are identified in the school setting or not. And then from that, we do testing on these individuals as well. So there isn't a single metric we look at, but we look at the number of contacts that become cases, and we have a rate for that. So we understand the risk on a per population basis, and that risk is lower than the general population as well. So again, this article, these acquisitions need to be looked at. Again, it's just one number, but there's a definition behind that number. So from the data we have, once you look at other numbers, once you look at contacts and cases, some of the testing that we do in the contacts as well, it's very clear that schools, with the procedures that they have in place, with the distancing in place, with the masks, with limiting classrooms and cohort interactions, make schools a safe place. So we are comfortable saying that.
Fair enough. Would that not extend into retail stores? Like we've shuttered retail stores in this province, most of them, other than essential services. And some of these numbers, even though they weren't made public, were used to suggest that acquisition was high in our retail setting, or cases were found in restaurants or whatever. I mean, restaurants on this list are further down than schools are, and so. I guess I'm trying to, if I was, just a random person, reading this and hearing what you're saying, I would be wondering, okay, if there's context to schools, then wouldn't that sort of thing extend to retail stores, and why then would you have to keep, retail stores shuttered if, it could be somebody from outside, like you said, 14 days coming from, well, maybe they went to the hockey rink or wherever and got that. I mean, I guess the numbers have been used to justify retail stores in the past, but the numbers aren't being used to justify schools now. I guess I'm trying to understand that distinction. Right.
So, I mean, you have to look at the time frame that the numbers was taken in as well. So let's say restaurants is a little bit lower on that list here, right? I mean, this data was collected from November 1st to December 15th. There was occupancy limitations on restaurants that were greater than the retail side, let's say, and restaurants actually had to close down as well, right? So that impacts the number on a percentage basis. So again, we are looking at that risk. So again, these numbers deal with not only just a number, there's a time frame, there's restrictions in place during when these numbers were collected as well and when the information was collected. So all those things are things that public health looks at to determine risk and determine what is low risk and where we can look forward to in relation to the orders to see what can be opened up from a risk perspective. So all that's taken into account.
From CBC Radio Canada, Gavin.
Hi, Dr. Atwal. We're January 13th now, and our numbers are still around that 150 mark. Are we seeing little effect from the gatherings on New Year's Eve?
Yeah, it's encouraging. I think we had a number of cases and a number of contacts that were associated with gatherings over Christmas time on the 25th, or we're basically an incubation period out from that as well. There's some gatherings related to New Year's as well, but it's hard to predict again where the numbers are going to go to, but this is encouraging. that we haven't seen a large bump up in cases. You know, we did dip down to below 100 as well, so we have to think about that. We do have pockets within Manitoba that are having some outbreak issues and having some issues in relation to COVID-19 as well. So we're definitely, you know, headed in the right direction. We still have a number of people in hospital in the acute care system, right? All surgeries aren't back to normal, so there are still staff being diverted to take care of individuals in ICU and hospitals in relation to COVID-19 as well. So I think, you know, from a Christmas standpoint, you could say we're an incubation period out, and that bump, maybe we've seen that already. New Year's is, you know, obviously several days later, and that bump is, you know, we're at the tail end of that pretty much over the next few days. So the next few days will be telling from a case standpoint and from a risk standpoint as well.
Concerning one of those pockets, the one in Lynn Lake, how did Lynn Lake end up with, I think you said 37 cases today? Was there a team doing targeted testing out there?
Yeah, you know, great question. So they've had a number of cases over several days. I don't have the total number. A number of these would have been related to a confirmatory test from a point-of-care test. So there's a couple of point-of-care testing devices out there that public health is using with the partners on the ground to look at case identification in a real fast manner to mitigate risk. So a number of these are secondary positives related to that. I just don't have that number on me.
Thank you. And finally, a question for Dr. Reimer. What do you make of the National Advisory Committee on Immunizations' decision to extend the maximum time between doses to 42 days? Is this something that might change Manitoba's vaccination plan?
Yeah, that's a great question. Thank you. The National Advisory Committee on Immunization is still recommending that wherever possible, that provinces and territories do provide that second dose on time following the manufacturer's recommendations. However, they have softened their wording and do provide some allowance that, you know, where it may not be possible due to logistics or due to the local epidemiology, that it might be reasonable to extend that second dose up to 42 days. So for now, our clinical team in Manitoba has reviewed the most recent NACI statement. We've reviewed the number of individuals that could be added to our pool of Manitobans who have received a first dose should we extend to 42 days. And we, for the time being, based on the lack of evidence and the lack of data that's available on moving outside of the manufacturer's recommendations, we're going to stay with the 21 days or 28 days, depending on the product. However, I think it's important to add a very strong caveat that data is going to keep coming in. So we're going to be getting information from other jurisdictions if they do choose to extend that second dose. There may be trial data that comes in, and our clinical team is going to be watching very carefully the science, and we may in the future take a different approach and extend that second dose if we can show from the science that that is safe and that the vaccine continues to be effective when it is used in that manner.
Thank you, everyone. This concludes today's media briefing.